And I'm going to do some more calls and I'll let you know.
Perfect. You let us know. We're more than happy to get that scheduled for you. If you reach this voicemail during regular business hours.
That sounded like a 1996 answering machine.
Hi, you've reached Family Dental with Dr. The office is open Monday.
Yeah, dead zero, man. Okay, we're going to move on to what I think is the most electrifying, crazy, cool part, which is mystery call. We are going to ask you for a competitor, somebody near you. We're going to call their office, not your office. That's not valid for California, Delaware, Florida, Illinois, Maryland, Massachusetts, Montana, Nevada, New Hampshire, Pennsylvania, and Washington, because we need their consent to record it. In every other state, it's a single consent state. In those states, you need dual consent, okay? So go ahead and put the practice name and telephone number, or just the name, and we'll Google it. And we're going to call some offices. We're going to do a little checklist and see how they do. Now, in this, I do want you to understand, we're not here to get anybody in trouble. We're not here to get anybody fired. We are here to just see what's going on. Okay, so I'm going to share my screen. We're going to do it on a scoring system. And here's the scoring system. We're going to use an Excel spreadsheet. Was the call answered quickly? 5 points for the first ring, 3 points for the second ring, 2 points for the third ring. You got the name and best number to call. 2 points for the name, 3 points, best number to call you back. Very, very important. Sourcing. Hey, can I ask you how you heard about the practice? Competent, professional. Were they competent and professional? Friendly, upbeat and caring, And how was their control and how efficient were they? And did they get the appointment? That's a 20-point potential right there. So possible score is 50. Miriam, do you want to just do a little role play here?
Absolutely. Let's do it.
Okay, good. So you're going to be the patient calling in. I'm going to be the receptionist. Ring, ring, ring. ABC Family Dentistry. This is Dan. How can I help you?
Hi, Dan. I'm calling in because I need some information as to what you guys charge for crowns. I apparently need 4.
Okay, well, I'd be happy to help you out with that. Can I get your name?
Sure, it's Miriam Creed.
Fantastic, Miriam. And Miriam, just in case this call drops, what's the best time to call you right back?
727-222-1122.
Thank you. And Miriam, last question before we get on to yours. Can I just ask how you found out about this practice?
I moved to the area just recently. I need a new dentist. I went to 2 places. One told me I need 3 crowns. The other told me I need 4 crowns. Prices are all over the place. So I Googled it, and you guys had good reviews. So I figured I'd give you a call.
Thank you. Do you remember what you searched? It just helps us.
Dentist near me for crowns or something like that.
Oh, okay, good. Thanks. Good. So let's get on to your question, Miriam. I'm going to have to ask you a few things about your mouth and what's going on to best ascertain and give you an answer to your question. What do you feel is going on? Did they tell you what was going on, and are you in pain? Give me a little background on what's happening inside your mouth.
I can't chew on my left side. I'm chewing on my right side because it's irritated. It hurts, especially if I eat hot food. And so I went to this dental office and they said, I need 4 crowns on that side. It's like, I don't understand. There's 1 tooth that hurts. Why is it now? Why do I need 4? And then they also said I need invisible braces.
Understood. Miriam, the tooth that hurts, where is it on the left side?
All the way in the back.
Okay.
At the bottom.
Okay.
Bottom.
Right. Okay. Do you remember when that first started bothering you?
It's embarrassing to talk about it, so I'm not going to tell you, but a long time ago.
Okay. It's okay. And then has it been progressively getting worse, or did it all of a sudden get much more painful recently?
I got really bad recently, which is why I started seeking out a dentist, because I'm very pain tolerant. So now it's at a point where I can't handle it anymore.
Understood. Me too. I'm just like that. When was that pain intensification point? When did that happen?
Like a month and a half ago.
Thank you. And Miriam, sensitive to cold?
No.
Okay. Sensitive to hot?
Yes.
Okay. And sensitive to pressure?
Yes, I guess. Can't bite on it.
Yeah, exactly. Okay. And then has it kept you up, the pain, has it kept you up at night yet?
Yeah, absolutely.
Okay. All right. So Miriam, obviously there's something going on there. That said, I'm not a dentist, so I'm not even going to try to diagnose. But I will tell you this, Miriam, the cheapest crown there is the crown you don't need. And what's a little bit concerning about what you just said is one said 3 and one said 4. My suggestion is do exactly as you're doing. Do some checking, but take advantage of a practice such as ours that offers a free second opinion. And a person can only, a dentist can only actually diagnose properly by seeing x-rays, etc. And it sounds like you've been around to a couple already, and that's already just, consumes time and energy and worry and concern. What we do here,
I just want it fixed.
Yeah, I understand. So here at ABC Family Dentistry, we do a free second opinion. Okay, so there's no obligation and there's no cost. Okay, but you just come in. We just want to see that you get the help you need. Even if you take our recommended treatment plan and you go to another practice, we're totally okay on that. We just want to make sure you get the help you need. Okay. Okay. Two things. I know that this is going to be a little bit of inconvenience, but I want you to avoid any, kind of solid foods and between now and the time you come in. Okay. And I know yogurt and all that stuff gets old, but we just don't want to tempt fate on that one. Second thing, I'm going to make it easy for you by, squeezing you in whatever's best for you. So I do have today at 2:30. I have today at 3:30. I have tomorrow at 9:30 a.m. Out of those 3 appointments, which one?
You said there's no cost to this appointment?
No cost.
Okay. Then let's do the 2:30 today. But can you tell me what you guys charge for crowns so that it's not like I'm coming in, we do the exam, and then it's a number that's even higher than what the other guys said. Totally. They charged me, they said 4 crowns at one place would cost me like $6,000, and at the other place it was $5,000 for 3. Okay. It's not even that I can't understand those numbers. Sure, it makes sense to me. Yeah. But it's just, do I really need all that? Yeah. Yeah. It's a fantastic question. I'm not trying to avoid your question. The thing is that a crown in our office can range anywhere from, just under $1,000 to sometimes over $2,000, depending on what needs to be done to build up the area, what materials, other things that I don't want to get into medical terms, but it's not even my place to do that because I'm not a doctor. But the variation is, where is the tooth? What's the condition of it? What can we do? What needs to be done additional? These sort of things. But in the prices that you gave there, I'll tell you this, ABC Family Dentistry, we're not the cheapest, but we're by far not the most expensive. And I think you're going to find our rates reasonable, but that's all down the road. Let's just do this. We're not trying to sell you anything. What we're trying to do is get you the help you need. And it sounds like we don't want any further delay in this. It sounds like you don't want any further delay in this. No, I'll be there at 2:30. Okay, sounds good. Let me get some information from you and tell you how to get here. I want you to think about a couple things. If the phone rings and I mishandle this, marketing, quote unquote, didn't work. No, marketing worked just fine. The phone rang. What didn't work is I mishandled the phone call. So without any further ado, let's make some phone calls. Let's see how it goes. Hey there. I was told I need 2 implants. I don't have insurance, so I'm just calling to find out, what does it cost for implants in this practice?
So unfortunately, we don't quote over the phone. Okay. If you are interested, we can get you set up for a consult. Our consults are $134, but unfortunately, we don't quote over the phone. Okay. Yeah. I just literally did this at another practice, and it was actually a little bit more. I spent about $180 just for kind of their quote, their estimate or whatever. But it was a little shock. Like I said, I don't have insurance. So it was a lot. But I need to get going on that. Okay. Well, I understand that. Thank you. All right. If you change your mind and would like to get something on the books, just let us know.
Okay. Thank you.
Bye. Yep. Bye.
Bye-bye. Okay. Okay. Think right now, everybody. What is 2 implants going to bring in your practice? How much? It's going to vary practice. Put it in the chat right now. What would 2 implants bring in your practice?
I think it doesn't matter because that phone call could have brought a patient in.
But just think about it. In your guys' practice, it's going to be somewhere between $4,000 and $6,000 per implant, right? I just want to do this for potentially $10,000, $12,000 worth of treatment. $5,000. We got somebody $5,000. Yeah, start to finish, Lynn. For 2 implants, we're going to bicker over $180 or $130. Anyways, just something I'm not telling you how to run your practice, but hey, guys from the Dr. Dell's team, do you guys do a free second opinion?
Only on days that end in Y.
Now you know why we love dealing with Dr. Bill's team. Yes, indeed. Indeed. And look at the numbers coming through in the chat. $15,000, 2 implants start to finish, $9,000. So I just want you to put this all into perspective. And what do you spend in marketing to get an implant lead? Like, think about those numbers. And you got somebody calling here asking for a 30-second opinion. So let's go through it. Okay. Did they answer quickly? I'd say yes. I'm going to give them 5 points. Did they get my name, number? No, that's 0. Did they ask how I heard about the practice? No. Was she competent and professional? I'd say medium on that one too. I'd give her 3. She was like, well-spoken and stuff. Was she friendly, upbeat, and caring? Put your thumbs in the air somewhere. Yeah, I'm not going to give her 1, but I'm going to give her a 2 because it just felt very cold. How was her level of ability to control me on the phone call and get me to do something? Yeah, that's a dead 0. And did they get an appointment? No. She got 10 out of 50. And we're wondering why, quote unquote, marketing isn't working in that practice. Had nothing to do with marketing. All right, let's do it again.
Hi, you've reached with Dr. The office is open Monday through Thursday from 8 to 5 and closed from 12 to 1 for lunch. If you reach this voicemail during regular business hours, we are away from our desk helping another patient.
Okay. Put your vote in the chat. What do we got? Yeah, dead 0, man. Dead 0. Imagine paying for marketing and your phone does that. 80% of phone calls are terminated when they hear a voicemail. That sounded like a 1996 answering machine. Should the phone be answered at lunchtime? Absolutely. And if you don't have personnel or you're overloaded, you should absolutely ask Miriam about the AI receptionist service that we have. Have someone or virtually someone that picks that phone up, handles it professionally, gets the data. I mean, I understand you can't be everywhere at once, but do not ever use a system that is a voicemail. Don't ever let that phone ring more than really twice. Yeah, they're still on lunch, and I understand that, but it's patients also on lunch. Patients also on lunch. Maybe that's the only time the patient could call. Listen, I'm sure they are wonderful people. That had nothing to do with it. They're great people. Even the first one, she's great. She's fantastic. She's in dentistry. She chose the healthcare over something far more glamorous. I love her because of that. I'm not talking about that. I'm talking about think like a consumer. And the consumer is unsympathetic to any factors that might be weighing on you and your team's ability to do their job. And marketing, they are paying for the marketing if they are, and marketing doesn't care. We're going to do the next one.
Thank you for calling Dental. My name is Tanya. How can I help you?
Well, hi there. Do you guys do dental crowns?
We sure do.
Okay, cool. Do you know how much they cost in your practice?
Without insurance, $1,500.
Oh, okay. Yeah, I don't have insurance, and that's certainly one of the better prices. I went to another dentist, and I went to go get those invisible braces. Do you know those?
Yeah, the Invisalign.
Yeah,
trays.
yeah. Do you guys do that too?
We sure do. Yeah.
Yeah, I went there, and I was all ready to go, and ready to pay, and then they said, "Wait a minute, you've been grinding," and I definitely do, and they said I've got cracked teeth, and I need to fix that before the invisible braces. So they told me how much the crowns were, and I about fell off my chair because I don't have insurance. So do you guys give a little bit of a discount if I did the 4, like a quantity discount?
Not that I'm aware of. Dr. does typically tend to try to be a little bit more lenient with patients, but that would be something that he would have to agree on. Okay. I wouldn't be able to just get liberty to tell you yes or no. I
can appreciate that. Well, listen, I'm just calling around different practices. This is certainly by far the best price, and I'm going to do some more calls, and I'll let you know.
Perfect. You let us know. We're more than happy to get that scheduled for you. We would just require a 30-minute appointment where we do kind of an evaluation. It can be a second opinion, which is no additional charge in our office. And then if you already have x-rays from a recent office or anything like that, then we can just use those. Otherwise, we'll get updated x-rays when you come in, whatever works best for you.
Okay. You're awesome. Thank you.
Perfect. You have a good one and good luck.
Okay. Thanks. Bye. Okay. So everybody do the numbers. 4 crowns and Invisalign. Let's just say typical. I know there's variations, but put that amount in the chat right now. What would that be in your practice? 4 crowns and an Invisalign case. Let's go like kind of like the softest it could be. I got $11,500, about $10,000, about $18,000, $15,000. Let's go through it. Okay. Did they answer quickly? I think they did. Yeah. So that'd be a 5. Did she get my name and best number to call me back? No, she did not. Did she ask how I heard about practice? No, she did not. Was she competent professional? Oh, I thought so. I thought she was fantastic. I mean, listen, it might not be what I would do or tell a team to do, but I thought she was very competent professional. Was she friendly, upbeat, and caring? Yeah, I think so. I'll give her a 5 just because I thought she was cheerful. How was her control and how efficient was she? Yeah, probably, like she didn't ask for an appointment. She didn't tell me. She didn't, a couple of things she did. I'll give her a 2 on that one. Did she get an appointment? No, she did not. Her score is 17. Let's just do this. Let's say, hey, Miriam, be the patient. Like, okay, good. I'm still going to call around the scenario, right? Like you don't confirm her appointment. Okay. So yeah, we can just get you in here. No charge, no obligation. And I've got today at 2:30. I've got today at 3:30. I've got tomorrow at 9:30. Which of those 3 times would best work for you?
Dan, thank you so much for this. What I'm going to do is I have 3 more practices on my list. Let me call through them and see what they have to tell me. And then I'll call you back and I'm going to let you know on what I decide. Just because I don't want to walk from practice to practice. It's easier for me to just call them.
I think so. Do this. I'm going to give you a couple tips. Do you got a pen?
Yes, I do.
Okay.
Ready.
You got some paper there?
Yes.
Okay, good. Write this down. Dan, ABC Dental. Okay, telephone number 212 555 1212. Just read that back to me.
Dan, ABC Dental, 212-555-2121.
It's 1212.
1212. Yeah. Okay, good.
Okay, good. So, Miriam, sometimes you're going to call practice and they're going to kind of give you the best case scenario, right? And the best case scenario, we hope that it is the best. Like I said, the cheapest crown there is the crown you don't need. But sometimes you need to do other things that is called a build up. And I'm not going to get into the clinical about it, but sometimes a practice will just give you the best case scenario. You come in, you find out it's something else. I want you to ask as many questions as you want. I want you to, if you get a little bit lost, you call me back. No dog in this fight. I want you to get the treatment that you need wherever you're comfortable getting it. Okay. So you call me back for any tips, advice, thoughts, feelings, etc. How's that sound?
I love that. Thank you so much.
Yeah, good. Go to it and best of luck. Okay.
Thank you.
Good. Tomorrow morning, I'm calling Miriam. Ring, ring, ring.
Hi, this is Miriam.
Hi, Miriam. This is Dan from ABC Family Dentistry. We spoke yesterday.
Dan. Hi. Yes. Hi. I remember you.
The doctor just walked by and saw that you called in, saw that it was kind of an emergency case, not technically an emergency, but, kind of critically important to jump on. He wanted me to call you and just make sure that you found a practice that you're comfortable with and you're going forward and you got the help you need.
I didn't, and I'm glad you called me back because even though you had me write your number down, I misplaced a piece of paper and I couldn't find it.
Okay. Well, sorry to hear that, but I'm glad we're in touch. Did you find, an appointment or, because I still got that 9:30 available and I've even got a 2:30 available today. I just want to make sure. Can I come in at 2:30?
I've been calling around and nobody answered my questions or points the way you did. Yeah. And even though you already said you might be a bit pricier than some of the others, I really feel like you care. And that matters to me more than anything else.
Fantastic. Let's get you scheduled. Now we do it again, Miriam. Let's say you did. So Miriam, the doctor just want to make sure that you found a practice and that you're happy. Did you find a good fit?
I did, Dan. I did. Honestly, a friend of a friend told me about a practice that belongs to their dad. And that's where I ended up going, family friend connection. So they got it taken care of and it was really good. Thank you.
But why didn't you choose? No, don't say that. Okay. Hey, Miriam, totally so happy to hear. Again, doctor just wanted to make sure that you got the service you need, that you're all set up. And you're going to remember my tip from yesterday, okay? Remember, soft foods until you get this thing. Even if you don't, you go in and, they schedule you for a couple of days, please, soft foods until you actually get that treatment, okay?
Yes. Thank you so much.
Yeah, just happy to hear that you're getting taken care of. You do well, okay?
Thank you. You too.
Okay, bye.
Bye-bye.
Okay, so folks, what do you think about a business that would do that would wish Miriam well? Thumbs up, medium, or down? What do you think? Heck yeah. Yeah. So be that person. Listen, of course, we would love to have her as a patient. We want her to do well. That's what we want. That's what we want.